Hello, I am Dr. Sathish, specialist pediatrician working in eye care clinic under Emirates Group of Hospital in Oasis Center. Today, I shall brief you on immunization. Nobody wants to get their children sick. It is better to prevent them getting any infection rather than treating them after getting one. Always, prevention is better than cure. We get infection when a pathogen enter our body. Then body start producing antibodies. These antibodies label and mark the antigen and help the immune system to destroy and remove them from the body. During this process, a memory system also is generated incorporating the antibody. So, when the same pathogen re-enter the body and infection happens again, this memory system, remembering it, mount immediate response against this pathogen and destroy them without allowing them to cause any damage to the body. This is called naturally acquired adaptive immunity. This immunity is always active in our body and safeguard us from any infection. The same immunity can be produced artificially by inoculating small part of the live or killed and attenuated pathogen into our body. This live or killed and attenuated part of the pathogen resembling the pathogen is called vaccines. BCG vaccine against tuberculosis, mumps MMR vaccine against mumps, measles, rubella, varicella vaccine against chickenpox, oral polio vaccine, rotavirus vaccine, and yellow fever vaccines are live vaccines. Other vaccines are either killed or attenuated or toxoid vaccines. Immunization is the process of inoculating these vaccines into our body for preparing the body in advance to fight against the infections. Vaccines are given according to the prevalence of disease, infections in different age groups in children. So, the immunization schedule may vary from country to country. Now, vaccines are available against most of the dreaded childhood illness. By immunization, we have successfully eradicated dreaded diseases like smallpox and polio from the earth. So, start giving vaccines at birth. Administer BCG against tuberculosis, oral polio vaccine, and hepatitis B vaccine against jaundice and liver cancer before discharge. Then 3 primary doses of vaccines against 9 diseases: diphtheria, whooping cough, tetanus, Haemophilus influenza, pneumococci, hepatitis B, polio, and rotavirus are given at 2, 4, and 6 months of age. To enhance the immunity, vaccines against diphtheria, whooping cough, tetanus, Haemophilus influenza, pneumococci, oral polio are given as a booster dose at 18 months of age. Vaccines against mumps, measles, and rubella and vaccine against chickenpox can be given at 1 year of age, and a second dose should be given after 3 months at 15 months of age. At 5 years of age, a booster dose against diphtheria, whooping cough, tetanus, and polio are repeated. The MMRV vaccine against mumps, measles, rubella, and chickenpox can be given at 5 years if it was not given at 15 months of age. After that, at 10 years of age, booster against diphtheria, whooping cough, tetanus, and polio are repeated, and every 10 years they can be repeated. Vaccines against hepatitis A, typhoid, and meningococci can be given after 1 year of age. A second dose of hepatitis A vaccine should be repeated after 6 months of the first dose. Typhoid vaccine should be repeated every 3 yearly. New vaccines like human papillomavirus vaccine against HPV causing cervical cancer in women should be given to all girl children, and if possible for boys also. If initial dose is given at 9 to 15 years of age, 2 doses 6 months apart, and if initiated after 15th birthday, 3 doses at 1 month and 6 months after the first dose should be given. Vaccine against H1N1 influenza can be given from 6 months of age. In the beginning, 2 doses at 1 month apart up to 8 years of age can be given. After that, every year 1 dose before the season can be repeated. Some vaccines like yellow fever vaccines are advised for travelers 10 days before travel. Vaccines against Japanese bee encephalitis and rabies also can be given to travelers going to the endemic areas. All vaccines are mandatory. There is no vaccine called optional vaccines. So, update about the new vaccines and give them as and when available to your children. No vaccine is 100% effective. So, check your blood for the antibody titer, and if the titer is low, give booster doses. So, try to get your child vaccinated against all diseases in time at appropriate age and prevent them from getting childhood diseases, vaccine preventable diseases. You can approach any of our branches for safe and painless immunization. Thank you very much.